Anyways, so let's say you're comparing a indirect bonding case to like your free bonding case, your regular bonding case. How much, like, what is your percentage of like, maybe like rebonding or repositions, bracket tweaking that you need to do towards the end versus an indirect bonding case? Like what, tell us some stats and some analytics.
Sure. So we did all our software was able to do all this reporting of patients who started with traditional bonding, I guess you want to call it, versus indirect bonding. And with indirect bonding, we were able to save 6 fewer appointments for a 24-month comprehensive case. So 6 fewer appointments means roughly about 6 months or 8 months. I don't like to bend a lot of wires towards the end. I like to have the brackets in the best position. And that's why indirect bonding is awesome. Like if you believe in straight wire orthodontics and straight wire appliance, that's the whole purpose of straight wire mechanics, is let the bracket do all the work for you. Sure, you might have to tweak a little bit at the end, at the end, just to get the marginal ridges exactly where you want it to, or small rotations. You might have to tweak at the final stage, but but most of the work, 80 to 90% of the work, just let your brackets do the work for you. And that's why straight wire is awesome. 6 fewer appointments, which is really great. Better results. I will show you some cases in a later date, another episode, in terms of marginal ridge discrepancy. You don't have to sit there and bend wire, step out bends, step in bends. It's kind of done for you. There's also patient comfort as well. Like they sit in the chair, the bonding appointment's a really successful appointment. And also time. You don't have to do the repo appointments. You don't have to schedule every like 6 months or a year out. Okay, let's schedule your repo appointment, which is another hour.
Exactly. That used to be something that I standard had to do. That repositioning appointment was just that we did.